We can make sure we're wearing masks. We can make sure ventilation is better in our buildings. So there's a number of steps that we can take that most countries aren't doing. And what's extremely distressing is to see political leaders doing exactly the opposite of what the health authorities know should be done. There's no one solution. I call it multimodal COVID control. And I've written a big piece on that for Project Syndicate, and a new piece is coming out very shortly, if it's not already, on Brookings. I'm a member of the
Brookings Institution.
yes, okay, of the Brookings Institution on the board, and I'm publishing a paper, one of their working papers, that goes through multimodal COVID control, vaccines, prophylactic drugs, contact tracing, really rigorous contact tracing, and isolation. No, very few countries do it. And then global cooperation, which we touched on, other countries helping each other. Now, if you look at a country that depends on vaccines like Israel, that hasn't worked. You look at a country like China that depends on public health measures, contact tracing and isolation. That works up to a point, but they keep shutting down whole cities. Very expensive. They just shut down Ningbo, right? The big port.
Yes.
Right? And they shut down this city, this city. It's working better than any other place in the country, in the world, except maybe New Zealand, but they're doing the same thing. So when you layer all these together, you have an opportunity to put it together, but no country has yet put them all together. Now, China is trying. Unfortunately, the vaccine that the Chinese are using isn't very good for Delta.
Doctor, what do you think of the zero case theory? I mean, some countries are trying desperately to have zero cases, but ultimately they are. New Zealand is now experiencing
They're
a
now having a
surge of
problem in New Zealand.
cases. Yes, they're having a problem.
And
Australia is also having a
Australia.
problem right now. Do you
One
think that
person,
controlling the disease, controlling the pandemic by shutting down the borders and doing increased lockdowns, does it
no,
does
look,
not help much?
look, my recommendation for the Philippines would to become the new New Zealand. You're not having time to vaccinate your population. If you don't vaccinate, you've got to be absolutely ruthless, like they are in New Zealand, like they are in China, in shutting this thing down. Otherwise, you're going to be left with an enormous problem. So right now, you can limit it. If you look at the number of people who died in China over the last year and a half, it's minimal. I would
Yes.
say, I don't know if it's under 100, but it's not very many. Okay, certainly under 1,000. Whereas we've had 600,000 people die.
Yeah,
So
yeah.
yesterday, 1,750 people died in the United States. It's shameful. Okay, China that to say that you can't control it absolutely isn't to say you can't control it almost practically. Yes, there's a cost, but what country in the world's GDP is increasing fastest? It's
Yes.
China's.
China. Yes.
China has done, it's not perfect. And that's why I'm saying you can't rely even on what the Chinese are doing. But if you don't have anything else, you surely should do that. And right now, the Philippines doesn't have anything else.
Hmm.
It
So.
should do what China does. It should be draconian.
Mhm.
And short-term draconian measures are long-term success. I have offices in Beijing and Shanghai, and those people for the last year and a half have been leading a very nice life. They go to parties, they go to theaters, not all the time. One time they'll be in a city and they can't do that, but it's only for 2 or 3 weeks. Then they go back to having a good time, traveling around. You can travel everywhere in China, but they're terrified to travel outside of China.
Yes.
Okay? And that's because they've done it right. Now, yes, they need better vaccines. Yes, they need better drugs. So you need a multi-layered system. One layer is not going to do it. But if I were going to pick one layer that will surely shut things down, it's what the New Zealanders and the Chinese have done. And there's a big difference between those countries. One is tiny and an island, and the other is enormous, right? And if you
Yes.
can do that for an enormous country, it's in the human capacity to do it, right? It is in the
Yes.
human capacity. We know as human beings how to do it. And you know what's sad for me is most of the techniques that they're using in China came from the Harvard School of Public Health when I was a professor there.
Wow.
Okay? So they just adopted our playbook and they did it very well. We have thrown away our playbook.